Thank you, Mr. Chairman. I think it's important for us to remember how we ended up here and how we've arrived at this moment. It was a choice. It was a choice to pass a bill last July that some call the One Big Beautiful Bill. I call it a betrayal of a bill. It was a choice to give tax breaks to billionaires and to big corporations at the expense of hardworking Americans. It was a choice to cut $168 billion from nutrition assistance programs for people all across this country. And yes, access to food is health care. It was a choice to take $1 trillion out of the healthcare system. It was a choice, and now there are consequences to that choice. The consequence is evident in the lives of patients all across this country and in communities that we serve. It's the consequences in emergency rooms happening right now where someone's life is at risk. It's consequences that are showing up in hospital budgets. And Nevada leaders have warned that residents will, quote, feel the ultimate pinch, and that the fallout from these cuts will be pretty horrific. And Las Vegas University Medical Center is bracing for $45.4 million in annual losses, while MountainView Hospital, owned by HCA Healthcare, is projecting an $18 million shortfall. Boulder City Hospital has already begun laying off about 70 workers, ending inpatient care and transferring patients elsewhere due to changes in the provider fee program. Make no mistake, these are likely just the first reported hospital job losses in my state alone tied to this one big, beautiful bill. Nationwide, Public Citizen recently found that 446 hospitals are at a heightened risk of closure or service reductions. That represents 69,000 beds, 6.6 million patients, and 275,000 healthcare workers that we depend on to provide this essential care. In Nevada alone, 4 hospitals have been identified as at risk, including St. Rose Dominican, DeLima, and Henderson, part of the CommonSpirit health system. Mr. Lassiter, I understand you may not be able to speak to the specific projections, but can you broadly speak to how the One Big Beautiful Bill impacts services that your hospitals provide? Briefly, please.
Thank you, Congressman Horsford. Would just say simply the impact of the bill for CommonSpirit is approximately $5 billion in lost reimbursement over the next 10 years. At its highest point, beginning about 2031, CommonSpirit will lose $1 billion in reimbursement that we currently receive.
Thank you. Mr. Woodhouse, will $50 billion in temporary rural funding make up for nearly $1 trillion in permanent health care cuts? Yes or no?
Well, no.
Thank you. Investing in the health and vitality of rural America is necessary and long overdue. I agree with the chairman and his passionate plea at the beginning of the hearing, but the reality is this fund, this Rural Health Transformation Fund, was not designed to replace or meaningfully offset the lost healthcare funding. If it were, we would see far greater flexibility to invest in workforce and direct patient care. Instead, much of the funding is geared towards building digital infrastructure, and while that has value, I've yet to see any technology that can replace doctors, nurses, and frontline providers, especially in rural communities like the ones I represent. And while rural hospitals are grateful for any support, they're also deeply concerned. They worry that program restrictions combined with limited state capacity will only make it more difficult. So, Mr. Woodhouse, will the Rural Health Transformation Program meaningfully help rural hospitals in my state? And how should families in these rural communities react when there are comparable or even greater resources being directed to high-profile presidential pet projects, international ventures abroad, and now a vanity project to build a ballroom at the White House?
Well, I think your constituents and constituents in rural America should be should be concerned. I mean, I was not a math major, but $1 trillion in cuts to Medicaid and a $50 billion rural transformation fund. The two are not comparable to one another. The Kaiser Family Foundation said they didn't believe a single state would gain more from the rural transformation fund than they will lose from the Medicaid
Thank
cuts.
you. Just in closing, Mr. Hazen, I know you work closely with SEIU 1107, which represents nearly 20,000 healthcare workers and public service workers across Nevada. They recently, after 13 months of negotiation, more than 300 employees secured their first contract, one that strengthens recruitment and retention and delivers average raises of more than 12%. So I want to ask you, can you commit to engaging in fair, good faith contract negotiations in Nevada? And can you commit to ensuring that equitable wage growth for your staff across the healthcare system, including at Sunrise?
We thank you, Congressman. Sunrise is a great hospital. We do approach our contracting with that attitude.